Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking all about newborn danger signs. If you remember, a newborn is a baby that is less than 28 days old, so that first month of life. Some of the things we're going to be talking about do apply to older babies, 2-month-olds, 3-month-olds, etc. But for the most part, we're going to be focusing on newborns, so those brand new babies. And I've broken this up into two parts. The first part is when to call the doctor. So there's a problem, but it's not necessarily an emergency. And then the second part is the emergency, when to call 911 or bring the baby to the hospital. So let's get into it. So this first part, there's a problem, but it's not an emergency. When to call the doctor. If the baby refuses several feedings in a row, this doesn't matter if it's breast or formula, they're just not eating. Especially in this newborn phase when they're learning to eat, it's much more difficult for them if they miss a feeding to be successful at the next feeding. So if they're not eating, they have several diarrhea diapers or vomiting episodes. So vomiting and diarrhea on an adult, we know that's not normal. It's also not normal on a newborn. It can present a little bit differently though. So several diarrhea episodes. Babies, especially in this newborn stage, they have transitional stools. So there's a wide variety of what's considered normal in their stool. And it can also depend on if you're formula feeding or breastfeeding, what their stool looks like. So diarrhea on a newborn is when they have 2 or more liquidy diapers. If they have one, keep an eye on it. It could just be a transitional stool, that's okay. But if they have 2 or more, that's diarrhea and you want to call the doctor. Same for vomiting. Babies spit up, right? We know that. But there's a difference between spitting up and vomiting. Spit up kind of like falls out of the mouth, okay? Kind of like unintentionally, like drooling. And typically it looks like mucus or it looks like what they've just eaten, either formula or breast milk. Vomit is more projectile, okay? There's more force behind it and it can look a variety of different colors. It can look like what they just ate, but it can also look things like green. It should never look red. If there's vomit and it's red, that's blood. So you want to call doctor right away if that happens. They have a cold that doesn't improve or gets worse. Babies are people, right? They're just little humans, so they can get a cold just like us. But remember, their immune system isn't well developed at this time. So if they have a cold that's not going away or it just seems like it's getting worse, you want to call the doctor. Any signs of dehydration? So dehydration can manifest a couple of different ways. Baby is very sleepy, you can't get them to wake up. They're refusing several feedings in a row. The soft spots, which are called the fontanelles on their head, they appear like sunken in or depressed. That's when you want to call doctor. But hopefully we get to them before it gets to this point, right? Hopefully you've monitored this and you've called the doctor before it even gets to this point. They have a rash. Very normal for newborns to get rashes. There's several different types of rashes, most of which are not a big deal at all. But if you don't know and your newborn has a rash, call the doctor to get checked out. Has drainage from their eyes or their ears? There is no reason that they should have either. So anything coming out of their eyes besides, normal tears or anything coming out of their ears, not normal. You want to call the doctor right away. They will not stop crying or they have a high-pitched cry. We also call this a shrill cry. So the kind of cry where it makes shivers go up your spine. You're like, oh, okay. That is a sign that baby is having some sort of problem, like pain. So babies shouldn't be in pain, right? It's not normal for them to be in pain. So this is a reason to call the doctor. Blood in the vomit or stool, we just talked about that. That would not be good. It would not be normal. They have temperature irregularities. So they either have a fever, which is greater than 100.4 Fahrenheit, or since newborns are still kind of learning how to thermoregulate, they're still learning how to maintain their own temperature because they've never done it before. It's new to them. They also can get really cold. Okay, so 97.9 or below is too cold for a baby. So what you'll do, you'll take their temperature, you'll see they're too cold, you'll wrap them up really good, put a hat on them, all of that stuff, And if it's not starting to come back up, you need to call a doctor, because temperature irregularities in a newborn can be a sign of infection. They're not having any wet diapers in 24 hours, so that would be very unusual for them not to pee at least once in 24 hours. And then finally, discharge or bleeding from the cord. Never. There should never be any discharge or bleeding from the cord. Not before it comes off and not after it comes off. That's not normal. And then if they are circumcised, if they've had a circumcision, they should not have any discharge or bleeding from that site. After that procedure, you have about a half an hour, so you'll still be in the hospital when this happens, where you might have a little bit of bleeding, you might have like a blood clot or some discharge. That's kind of the time frame where it's okay. But if you're at home and you're caring for the circumcision site and you notice there's discharge or bleeding at that point, not normal, and you need to call a doctor. Now let's talk about the emergency stuff. So when to go to the hospital or when to call 911. If your baby is having trouble breathing or is having apneic spells. So babies are still learning how to breathe, especially in this newborn stage. They're getting used to it. So they have irregular breathing patterns. That's okay. Apnea on the baby is defined as not breathing for greater than 20 seconds at a time. So if your baby is doing that, then you need to call 911 or you need to take the baby to the emergency room, because that is not okay. The baby is very hard to wake up or won't wake up at all. The baby has a seizure. Seizures are not normal in this newborn stage. Unless your baby has some sort of already pre-diagnosed congenital thing, it's not normal for a baby to have a seizure. And they don't typically have seizures like those big grand mal seizures that adults can have. So keeping an eye out for that, and if they have a seizure, obviously that's an emergency. If the baby is limp and has no energy, if you think someone has shaken your baby, right? So you've left the baby with a nanny or a babysitter or a grandparent, somebody is watching the baby, and you think the baby might have been shook during that time, they need to be evaluated. You have thoughts of harming your baby. This is a sign of postpartum depression, and you need treatment for that. You need to seek help for that, for your safety and the safety of the baby. And exposure to poison. And by poison, for a newborn, that can mean almost anything, right? Not actual poison, it could be literal poison, but it could just be exposure to household chemicals or medications, things like that. Remember, in this newborn stage, it's either breast milk or formula. That's it. That's all they're consuming. So they shouldn't have anything else. And then, what does a baby in distress look like? What are some signs of distress? They have an increased respiratory rate. So a normal respiratory rate for a newborn is 30 to 60. So anything greater than 60 for an extended period of time would be a sign of distress. Retractions. So they're having such a hard time breathing that they're using their abdominal muscles, and then you can see pulling of their abdominal muscles when they're breathing. Nasal flaring. So babies, being obligate nose breathers, they breathe through their nose. So if they're not getting enough oxygen, they try to widen their nostrils as much as possible to take in as much air as they can. Cyanosis, so if they're turning blue. And then grunting, that crying, grunting, kind of a sound. That's not normal for babies to make that sound. That means they're having a hard time breathing and getting in enough air. So that was my video on newborn danger signs. It wasn't meant to scare you or freak you out or make you paranoid. It was just meant to educate you on things to look out for, and if your baby needs help, you can get it help right away. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know, and if not, I'll see you on the next one.